and would like to welcome our special guest, Mr. Phaneesh Murthy, who is a co-founder and executive chairman to the Phaneesh Murthy Health and Life Care. Mr. Phaneesh Murthy is a technology industrialist who, throughout his career as a leader, having had pioneered newer business models and basis of differentiation for higher growth. He has few credits to himself. He was credited with the growth of Infosys from less than $2 million in 1992 to $750 million in 2002, and having achieved a net income of 33% post-tax and a market cap in excess of $38 billion. While at Infosys, he has been a member of the board and has overseen the global operations in sales and marketing. He has also been a part of the team which has taken Infosys public on 2 exchanges in India and the United States. More credits to him. He is also the one who has pioneered the concept of packaged services and has introduced many high-value services and pioneered client acquisitions and models. He has also been the lead on the small venture fund that Infosys has created in the late 90s. Having said that, he has also started the Progeon as a subsidiary of Infosys and has raised a venture capital of $25 million and has been the chairman. All of this growth, which has been during his tenure, has occurred at the back of his offshore delivery model, which has ensured the work which has been done remotely, rather than from people coming onto the client side to do the work. In 2002, he has raised $30 million and has started an organization called Quintant, and the first integrated technology and operations company. Quintant was merged and has also he has been a part of the iGate organization. Mr. Phaneesh, as a CEO and the current executive chairman to his organization, PMHLC, has now come up with a special enterprise into health exchange. We invite Mr. Phaneesh Murthy to the dais.
Hi. Good evening, everybody, and it's a great pleasure to be here. When Dr. Rajendra Gupta asked me to come and speak here, I was quite flattered. Requested me to speak about how I see technology changing the face of healthcare. I think somebody asked me earlier today, where do I see technology adoption in healthcare in India? And I said probably on a scale of 10, 1.5 or 2 at best. I feel that there is significant scope for changing this, and the 3 themes that we are trying to take as an organization, and I think as a country we need to take. One is improving the quality of healthcare. How do you use technology to improve the quality of healthcare? Second is how do you use the technology to improve the efficiency of healthcare? And third is how do you use technology to make healthcare more inclusive or accessible to everybody in the country, rather than just few pockets in Mumbai or few pockets in Bangalore or Delhi or whatever it is. So those are the 3 broad themes. What I thought was I'm just going to take 3 examples of what is the art of the possible. The first one is what we are thinking is this whole concept of a patient-controlled electronic health information record. So far, what everybody has been trying to do, almost all the countries in the world, if you look at it, what they've been trying to do is this whole concept of a provider-controlled electronic health information. The challenge in India is that there is no concept of a primary care physician. And because there's no concept of a primary care physician, we go from one doctor to the other. And one of the things any doctor will tell you is that in case you have a problem, the thing that he first wants to know is your history. And without history information, it becomes very difficult to diagnose the problem effectively. Most doctors in India and most hospitals in India don't have computerization. 95 to 97% of us who access healthcare services in India just don't have, are going to doctors who have maintained no records at all of ourselves. And consequently, the quality of care suffers quite dramatically. So what we are recommending is really the concept of an absolutely free but highly secure way to maintain your own electronic health information, and not just yours, for up to 6 members in your family, with the clear goal being that you can do it for your parents, for your children, and so on. And it is secure and it's controlled by you, so you can give access to whoever you want, or you can actually provide access at the time a new doctor is seeing you and is trying to do something. So I think that is the first thing which we feel will start changing the quality of care in India in some fairly significant way. The second thing, which I think, if you start looking at technology and the world of big data and analytics today. So I was quite fascinated. I met a gentleman in San Diego who considers himself the first human guinea pig. So what he has done is that he has introduced about 1,000 markers in his body. And it's interesting to note this because typically, even when we go for extensive tests, most doctors can interpret only 30 to 40 markers. And what he has done is he's introduced 1,000 markers in his body, and he records using these 1,000 markers, the readings of it. Every morning is anyway taken. During the day it's taken. What he's recording is how he's feeling at various points of time. So he's recording at 9 o'clock, I'm feeling really good. At 10 o'clock, I'm feeling down, or whatever it is. At 12 o'clock, I'm feeling very lethargic, blah, blah, blah. And then using all of these 1,000 markers, where your level of chemical A is at this point, your level of chemical B is at this time. They're trying to use all of those 1,000 markers and trying to figure out and plot based on how he's feeling and try and draw correlation metrics for this, which is hopefully going to improve the quality of care over the longer period of time. And he just wants to do it for himself, to try and, so he just goes to the doctor and he says, these are my 1,000 readings. So his conversation with his doctor is very different from our conversations with our doctor. So similarly, one of the things that we wanted to try and do was to try and figure out, is there, with all of the data that we are going to be collecting and with all the data that we are going to get, can we figure out and start doing micro level analysis for data, but at the same time aggregate data? It's not violating anybody's confidentiality, it's not violating anybody's security, but can I turn around and say that in this pin code in Delhi or in this pin code in Mumbai or whatever it is, the incidences of cancer are so many per 1,000, which is statistically very significantly different from any other pin code in India. So at that point of time, now you can start looking at issues like air quality or water quality or any other kinds of things and start figuring out what is the reason for doing some of these kinds of things. All of this is going to be more and more relevant, particularly because research is suggesting that by the turn of the century, by the turn of this century, life expectancy will be about 140 years. That puts a completely different spin on what middle age is. Because if you are expecting, or if you are going to live to 140 years, you can't afford to be bedridden for 60 out of those 140 years. And so the quality of life will become very, very critical. And how you change that quality of life is absolutely key as you start doing all of this micro level data and analysis, and you start making sure that this data is available to the regulators for them to be able to do certain things with it. So can I force the regulator in a particular area to do something about a brick factory which is there because I have proved that the air quality there is so bad that I have 10 times the number of incidences of asthma or bronchial asthma or some respiratory disease. So I think that's the second important thing of technology and the analytics world that we are thinking about in terms of implementing with all of the data that we collect. The third important thing, of course, is the fact that more and more now, we are finding that support groups are becoming critical for mental well-being of patients, and these support groups are more important than any kinds of medication that you will actually get. So one of the things that we feel India does not have a concept of quote unquote the softer side of life. We just don't worry about all of these things. We don't worry about what is the implications to the person's family when a person is suffering from pancreatic cancer. We don't worry about what his family is going through, what he is going through mentally. We know exactly what the illness is doing to his body. But we don't actually worry too much about what is happening to his mental well-being and so on. And therefore, the plan is to try and see if we can connect anonymously and confidentially, let's say 20 patients who are suffering from a rare form of cancer or something like that, so that they can share their experiences with each other, they can share how their families are reacting and what is happening and so on and so forth. And I think all of that will start impacting on their mental well-being. And if tomorrow they want to take the next step and try and create a physical group of it, we can facilitate that, but that's something up to them to try and create a physical group of it. So I think if you look at broadly the use of the technology for all of these kinds of things, then I talked about the concept of accessibility. Today, if you go to many other parts, the quality of healthcare in India deteriorates very dramatically beyond the 5 or 6 cities that have got reasonably good quality care. And how do you make sure that access to specialists is provided, access to qualification, access to fresh medication which has potency, all of those kinds of things, how do you ensure that that is provided for all over India? I think that that's the next real piece of technology solutions, right? So the concepts of your telemedicine, the concepts of the ability to sit down potentially with a nurse in one part of the world, one part of India, and meet a doctor who's a specialist in something in another part of India, and together the nurse who's local to you and potentially the doctor who's far away from you, how are you creating those kinds of solutions, and how are you ensuring that the right medication reaches that person rather than the medication which is one day before expiry date or whatever it is. So those are the kinds of issues, and authentic medication reaching that person, etc. So I think that's the second part around accessibility. And then the third part clearly around affordability is based on concepts which are of the type which say that, can I create a group out of all of these, let's say millions of consumers, and can I start negotiating better rates from providers? Can I start negotiating better rates from insurance carriers? And how do you make sure that all of that efficiency gets passed on to the consumer? How does he get access to what other patients feel about a doctor? Right? So today the whole, today when I go to a doctor, I really don't know very much about him. Maybe there's a little bit of word of mouth. What I'm trying to do is, can we formalize all of that word of mouth? And if you want to go to a nephrologist, what are the last 10 patients' reactions or ratings on this nephrologist in terms of how he was treated by the nephrologist, how he was treated by how he was treated by the hospital where the nephrologist was, and so on and so forth. So I think if you look at the broadest philosophy, what our goals will be, and what my personal aspiration is for the country. I know the young lady read out a long history, but I just do want to tell you one simple anecdote. In 1992, when I first went to the US to start selling Indian IT, nobody in the US even knew where India was on the map of the world. It was that poor knowledge about the country, right? And today, it's a fascinating thing for me that I used to put my first slide as, where is India on the map of the world? That used to be my first slide in my corporate presentation. Today, if I just tell them our office address, they will tell you how far it is from the Leela Hotel or the Taj Hotel. Right? That's the level of awareness change. And if an Indian is walking along on the street in Silicon Valley or in New York, most people will immediately jump to the conclusion that there's a 95% probability that he's a software engineer. That is what's happened to the world of Indian IT over the last 20, 25 years. And my personal aspiration would be, nobody talks about Indian health. So if I go back 1990, nobody talked about Indian IT. Nobody talks about Indian healthcare. Nobody thinks highly of Indian healthcare today, globally. And my personal aspiration would be, can we use technology to create, in terms of quality of healthcare, accessibility and inclusion of healthcare, and efficiency of healthcare, a role model for at least 70% of the world's population, if not 100% of the world's population. That's the journey that I'm embarking on, hopefully over the next 15 to 20 years of my life. Thank you very much.